Good morning, I am Ivan Clarence Mindaros, your student nurse from Davao Doctors College, and for today's video, I'm going to do an assessment of cardiovascular system return demonstration. Prior to conduct of procedure, first, I am going to review my client's medical records. This is to discover patterns that help doctors make decisions about patients' medical care. Next, we have to prepare the necessary equipment needed. The equipment that I'm going to use is a pen light, rectangular card, a centimeter ruler, and of course a stethoscope. This is to conserve time and energy. Before conducting the procedure, we have to perform hand washing to remove germs from hands, and it prevents infections. So good morning, sir. I'm Ivan Clarence Mindaros, your student nurse today. May I know your name, sir?
I'm Marangelo on the right.
Okay, your birthday,
October 14, 2003.
your address.
Barangay Dawis, Mayamay.
Okay, this is to know that we are assessing the right client. Okay, thank you very much, sir. Today I'll be assessing for your cardiovascular system, which means I'll have to check your pulse on your neck, your arms, legs, and of course, listen to your heart sounds. Do you have any questions or clarifications, sir?
None, sir.
Okay, now I'm going to close the door and curtains so that no one will disturb from outside. This is to ensure the client's privacy. So let's begin with a short interview. Do you have any specific complaints, or are you feeling pain in your chest or your extremities, sir?
None, sir.
Okay. Have you experienced shortness of breathness, dizziness, headache, anything like that? Okay. Do you smoke?
No, sir.
Okay. There any history of hypertension, myocardial infarction, coronary heart disease that has affected your family?
None, sir.
Okay. What are your usual activities?
I play badminton, sir.
Okay. Do you exercise?
Yes.
Okay. Thank you very much, sir. Now let's begin with your assessment. Let's start with assessment of the jugular veins and the carotid arteries. Inspection of the vessels can provide information about the blood volume and pressure in the right side of the heart. First thing to do is to position the client's spine with the head elevated between 30 to 45 degrees, making sure that the head of the torso of the patient is on the same plane. Visualizing of the jugular veins is best on this angle. Next would be turn the client's head slightly away from the side being examined and shine a tangential light source to the neck and suprasternal area in the area around the clavicles to observe for any pulsations or shadows. So we can clearly see the vessels very good. If jugular distension is noted, assess the highest visible point of the distension of the internal jugular vein. Next is raise or lower the bed until the highest point of the distension could be observed. It can give insight into the hydrodynamic status of the heart. Now measure the vertical distance of in centimeter ruler above the sternal angle by extending a long rectangular card horizontally from this point. Now repeat on the other side. Okay. Now we're going to assess the carotid arteries. With the head of the bed elevated at 30 degrees, slightly turn the patient's head toward the side being examined and palpate the carotid artery, cautiously avoiding too much pressure or massaging the area. This is to give insight into left ventricular systolic function and distinguish types of valvular heart disease. Next, turn the client's head slightly away from the side being examined, then place the bell of the stethoscope over the carotid artery to know if there is a bruit or trill sound. Hold your breath, sir. Now let's proceed for the assessment of the heart and for the inspection and palpation. Now inspect the chest wall. This is to see visible external signs of respiratory function. Okay. Now inspect the precordium for persuasion while palpating the aortic, pulmonic, tricuspid, and apical area. This is to know if there is a sign of right ventricular hypertrophy. Now for trills. Okay. Now palpate the impulses using the finger pads or flatly or obliquely on the aortic, pulmonic, tricuspid, and apical area. This is to note if there is a presence of pulsations. Now palpate the apical impulse using 2 to 3 finger pads. This is to evaluate cardiac function. Now palpate the apical impulse area. Then reposition the client to roll partly on his left side lateral side and palpate again. This is to clearly palpate the apical pulse. Please rotate, sir, on your left side. Like that lang, sir. Okay, please roll. If still unable to palpate for the apical impulse area, then ask the client to exhale fully and hold her breath for a moment. Again, sir. So, then hold your breath, sir. Okay, now breathe on your box, sir. Now inspect and palpate the epigastric area. Looking for any deviations. Now in auscultation. Now I'm going to assess for heart rate and rhythm by counting the heartbeat for a full minute. This is to provide information in the regularity of heartbeat and an indication of the strength of heart condition. Now using now using the diaphragm of the stethoscope, auscultate the hair in all four anatomic sites, which is aortic, pulmonic, tricuspid, and apical area. Now I need you to breathe normally, sir. This is to look for any abnormal sounds of the heart. Now, now I'm going to roll this client. Now, sir, please roll slightly on your left side, sir. Inhale and exhale, sir. Stop, sir. Inhale, exhale, and stop. Now sit down, sir. This is to get more information for the abnormal sounds of the heart. Inhale and exhale, stop. Okay. Examining the upper extremities. Now I'm going to assess the peripheral vascular system. I'm going to assess the arm. This is to know if there is any changes of the skin that gives important information about potentially serious disease. Okay. Inspecting the peripheral veins in the arms. This is to look for any blood clots. Now I will palpate the radial, ulnar, and brachial pulse. This is to know if their pulses are working. Now for the capillary refill. This is to monitor the hydration in the amount of the blood flow to tissue. Now we will be going to perform the Allen test. Sir, I need you to open and close your hands quickly and close your hands tightly. Okay, sir. Open and close your hands quickly. Now close. Open, sir. Okay, again, sir. Close. Open, sir. Okay. The other side. Open and close, sir. Open, sir. Okay, again, sir. Open, sir. Okay. Now for the lower extremities, I'm going to expect the legs. Now for the peripheral veins. Now I will palpate for the popliteal dorsalis pedis and posterior tibialis pulse. This is to know the pulse if the pulses are working. Okay, now I'm going to dorsiflexing the client's foot. This is to assess for ankle chlorus. Now for the capillary refill. This is to monitor the hydration in the amount of blood flow to tissue. Now we're done assessing the cardiovascular system. This word is your tissue. Okay, sir. I will be summarizing all the assessment that we assess. While assessing your jugular veins, sir, veins are not visible. That indicates your heart side of your heart is functioning normally. While assessing your carotid arteries, no sounds on auscultation. That means normal. While inspecting and palpating your aortic pulmonic area, no pulsations. Your tricuspid area, no pulsations and no lift or heave. That means normal. Your apical area pulsations visible in 50% and no lift or heave. While auscultating your heart rate and rhythm, all sides are heard and louder at apical area. While assessing on peripheral peripheral vascular system at upper and lower extremities. Pulses are detected. For capillary refill, immediate return of color. Inspecting your peripheral veins on arms is color is pink, temperature not excessive warm or cold, no edema, and skin textures are resilient and moist. For the legs, the size is symmetric in size and the limbs are not tender. Overall, sir, is normal. This assessment is this assessment, sir, is to detect peripheral and systematic effects of cardiac disorders and evidence of non-cardiac disorders that might affected your heart. I suggest you to sir I suggest I suggest you, sir, to maintain your healthy living, eat healthy foods and do exercises. That's all for today, sir, and that's all. Thank you.